Hi, my name is Praveena. Today is the 24th of September and this is my airway management video. The skills that I've undertaken in this video are lateral position, triple airway manoeuvre, insertion of an OPA and NPA, using a laryngoscopy and assisted positive ventilation using the BBM bag. Enjoy. Now I'm going to be demonstrating putting a patient on the lateral side position. The indications for doing so is your unconscious patient and or patients who are at high risk of aspirating. To start off with, you need to check our patient's pockets to make sure that there's no objects that could cause harm to ourselves and or the patient. Placing a towel and or a cushion under the patient's head just to ensure stability of the head. Lifting up the leg closest to our side up and the arm on the same side across their chest. Extending their opposing arm at a 90-degree angle, placing ourselves nice and close to the patient, one hand on the patient's shoulder, the other on the patient's hip, gently rolling them over, placing the same leg just across and their hand just close to their face, and that's to prevent them from falling forward, and extending their head so as to promote airway patency and to ensure any fluid drainage. Now I'm going to be demonstrating the skill of the triple airway manoeuvre. This is done in patients to maintain airway patency and to check for any obstruction. We need to make sure with an adult patient that we've got a towel or a cushion to support their head. With our right hand, tilting the patient's head back with my thumb in the middle of the patient's forehead and placing my other hand just around the patient's mandible and my thumb on their jaw, protracting that forward, and that's to stop the tissues and the tongue from obstructing the airway. Our third step is placing thumbs on the patient's zygoma and the other fingers around the mandible, and that's just to maintain the airway patency. A common error which is made is hyperextension of the neck, which can cause further obstruction to the airway, and the main difference between the sniffing position and the triple airway manoeuvre is that with your sniffing position, you're just tilting the head back, and that's just to allow for the insertion of airway adjuncts. Now I'm going to be demonstrating the skill of inserting a oropharyngeal airway. The indications for doing so are your unconscious patients to maintain forward displacement of the tongue, and your contraindications are patients with a gag reflex and who also have trismus. So this is often performed after the triple airway manoeuvre. To start off with, we need to make sure that the patient does have something to support their head, tilting the head back, inspecting their mouth to make sure that they have no particles that can cause obstruction. With your OPA, we need to measure it from the tip of their mouth to the tip of their mandible. Once you lubricate that, you need to insert it upside down until that's halfway into the patient's mouth, rotating it 180 degrees, and then inserting it until the flange rests up against the patient's lips. A common error which is made is not measuring the OPA correctly, and doing this can often cause damage to internal structures of the mouth. Now I'm going to be demonstrating the skill of inserting a NPA. The indications for insertion of this is your unconscious patient where airway patency is compromised and where an OPA has been difficult to insert. To start off with, we need to place a pillow or a cushion under the patient's head. The contraindications as well for this is patients who have got severe nasal trauma and or patients that have got middle third facial fractures. So the measurement of your NPA is from the tip of the patient's nose to the earlobe. Lubricate that, placing the head backwards, tilt it. We're inserting the NPA at a 90-degree angle, inserting in a rotating motion until the flange rests up against the patient's nostril. We need to be careful when doing this because if you don't insert it at a 90-degree angle, it can cause further damage to patients who are presenting with basal skull fractures. And once again, just looking and listening for breathing. Now I'm going to be demonstrating the skill of inserting a laryngoscopy. To start off with, we need to make sure that we've got a cushion or a pillow placed under our patient's head, checking the equipment that the light is tight and bright, pulling our patient's head backwards so that we've got the head in the sniffing position, placing our right hand on the patient's head, getting our laryngoscopy, checking the mouth as well, and placing that in from right to left in a lifting motion and not in a hooking motion, as that can break the teeth and cause choking. We're making sure that we've got the vocal cords in view and checking for any foreign objects within the mouth and if there is any suction if required. be performing the skill of assisted positive pressure ventilation. To start off with, you need to make sure that you've got a towel or a cushion under the patient's head and ensuring that they've also got a OPA in situ. Getting a BVM, making sure that you've got the correct size adult mask, placing that over their nose and mouth, placing your thumb and index finger around the mask and your third, fourth and fifth finger around their mandible. When ventilating, we're assisting at a rate of 10 mils per kilogram. While doing this, we need to ensure that the patient does have a rise and fall of their chest, and at the same time ensuring that we're not hyperinflating the chest so as not to cause barotrauma.